Well, so it's interesting you say that. So like I'm a surgeon and it's not just sexual function. I operate on testicles too. And when I operate on testicles, when you expose them, they're actually bright blue.
Really?
No, they're not.
Doc, I know we've got a rapport here. I am a low IQ guy. If you tell me something, I will believe it. What's going on, everybody? Welcome back to Uncomfortable Questions. I'm your host, JC Mendoza, and with me today is my favorite board-certified urologist and the greatest SVP in men's sexual health history here at HIMSS, Dr. Peter Stahl. Dr. Peter, it's great to have you here with me.
I'm excited to be back, JC.
I'm excited for you to be back, and I'm excited to talk about our topic today, because I feel like in our history, we've traversed a lot of uncomfortable questions, but this might be the biggest, most philosophical question that I've ever asked you.
Oh, wow.
Right up there with what came first, the chicken or the egg, who built the pyramids. Dr. Pete, I want you to say it for the record, just so everybody knows, are blue balls real?
Wow. Okay.
Yes.
That's
what we're doing today.
That is deep.
It's I told you what it was when I asked the question.
So are blue balls real?
Are they real?
I'm going to say yes for some people.
Okay.
So blue balls really refers to like a symptom of like aching, pain, or discomfort.
I'm familiar.
After prolonged sexual stimulation without a satisfying ending to that sexual stimulation. Yeah. So a couple of like really critical things to say. First of all, blue balls, even if they are real, are not a reason to compel another human to engage in sexual activity with you. And that's a patient, comes in, can I have a note to give to my wife?
That's a dedicated.
The answer is no. So we're laughing about it, but there have been like real, actually like bad, unethical situations where people are trying to compel their partner to have sex with them with a guilt trip related to, and that's wrong.
I feel like that's like the genesis.
That's like a no.
Yeah, where blue balls, like the whole idea of it came from that like type of pressuring energy. That's
but so that being said, right, there is, so like when someone's sexually aroused, the body's response to that is in large part related to increased blood flow to the genital organs, right? That's what an erection is actually, right? It's like a massive influx of blood flow into the penis. So pressures and blood pressures inside the genital organs, and that includes the testicles themselves and an organ adjacent to the testicles called the epididymis, and the penis. And blood flows in, pressures get high, and then in a normal situation with orgasm and ejaculation, that is sort of a cathartic event. Everything relaxes, the pressure gets released, and without an orgasm, there is a theory that some of that high pressure in those organs might remain, and that pressure creates stretch, and that stretch of your balls or the epididymis can be very like uncomfortable, aching, and painful. And so that's where this idea, it's called epididymal hypertension, which means high pressure in the epididymis adjacent to the testicles, which is a very sensitive organ. So maybe that's like what people that do experience pain or discomfort or aching.
What do blue balls feel like medically? What's the explanation of that sensation?
So like aching, pain, throbbing, like these are the words that people that describe blue balls use when they're describing, what they feel. Yeah. And I think that's real for some people, for sure.
Can I ask, because I understand the term is like rooted in a real sensation, but the name blue balls, where does that come from? Is there any medical history of somebody's testicles actually turning blue?
Well, so it's interesting you say that. So like I'm a surgeon and it's not just sexual function. I operate on testicles too. And when I operate on testicles, when you expose them, they're actually bright blue.
Really?
No, they're not.
Doc, I know we've got a rapport here. I am a low IQ guy. If you tell me something, I will believe it.
No, I think that the term relates to like when you have venous engorgement. So venous blood is like a darker shade of red. It's almost purplish. And sometimes that looks kind of blue through the skin. And my guess is, and I don't know this, is that somebody came in with, testicular pain or discomfort following sexual stimulation without orgasm, and someone did a physical examination and saw some distended veins, thought it looked a little blue, and called them blue balls.
How can you treat blue balls?
So you don't need a doctor to treat blue balls. As we talked about before, you don't need a sexual partner to
For sure.
bring you to orgasm. What you need to do is wait, take a cold shower, relax, masturbate, just anything that reduces blood flow to the genitals, which is non-sexual activity. And sometimes having an orgasm, some patients describe that like, bringing themselves to orgasm can relieve everything. There's zero danger. If you do nothing, it goes away with time.
Right.
And but if you want to feel better faster, those are some of the things that somebody can try.
Got you. That's probably a nice like treatment for you to give. Like, hey, either finish yourself off or just wait. It's like, all right, both of those things I'm generally fine with. So that's a good. I like that the treatment is very fair.
I'm glad that you're comfortable.
Because these topics are not. So somebody's got to be. Are there other things that can cause pain or discomfort in the testicles that might be similar to blue balls but are not?
Yeah. So that's a really good point. So like, just because you had a sexual encounter and you have testicular pain afterwards doesn't mean that pain is caused by, like, there are serious medical things that cause testicular pain, things like testicular torsion, which is a medical emergency, infections, inflammation, other anatomical abnormalities. So, persistent pain that's not just a slight ache is something that everybody should take seriously and seek medical attention for.
Yeah. So we talked about the things that could be confused with blue balls, but I also want to know, are blue balls, is that a sensation that women can also feel? Like, is that a diagnosis for women as well?
Well, the diagnosis blue balls is not a diagnosis for anybody, but the answer is yes, actually, right? So the increase in blood flow that occurs during sexual stimulation for men also happens in women. It's increased blood flow to the pelvic organs in women, and the labia or other parts of the vagina get engorged, and the persistent engorgement and pressure related to that can cause something that doctors call vulvodynia. Vulvodynia.
Okay.
I don't even know if I'm saying it right, but
yeah, that's a term.
it's pain in the vulva.
Okay.
And that is something that can happen,
Vulvodynia.
or that has been described in women after prolonged sexual stimulation without an orgasm.
I know men, we have the term blue balls. That's like to make it like easy to say. Is there a version of that for women? Like not blue balls? Would it be like?
I think this is your chance.
I was about to say, because I got a couple that I was going to bring off to you. And thankfully these questions are uncomfortable because these suggestions are about to be as well. How do you feel about lavender labia?
I feel pretty great about it, actually.
That's not bad.
It's not offensive.
Lavender, or even less lavender lips. That could be like a nice, like, it sounds like a nice perfume or cologne that I would spray.
Yeah, you do that.
I will, and I'll let you know how it goes. And thank you so much for being here today, Dr. Pete. You always bring us right where we need to be on all these uncomfortable questions. And we can't do it without you guys at home. And we hope you guys feel informed by the information that Dr. Pete is kind enough to bestow upon all of us. And if you would be so kind as to bestow upon us a like, a subscription, a follow, so we can give you guys more answers to plenty more uncomfortable questions. I really do stand by Lavender Lips. I think that's a good brand name. And if nobody here takes it, I will.
Okay. It's all yours. I think they're still filming, unfortunately.
I know, man. Hey, I'll stand on that.